Welcome back, and thanks for tuning in to this lecture on Torsades de Pointes from CyberMD. As future healthcare providers, it is essential to have a thorough understanding of this life-threatening, polymorphic, wide complex tachycardia, especially when you're preparing for the USMLE Step 1 exam. In this lecture, we will cover many of the aspects of torsades. Please be sure to like, comment, and subscribe to our content so that we can continue to provide free medical education resources to students around the world. The underlying cause of torsades can be due to various factors, typically long QT syndrome, medications that have the potential to prolong the QT interval, electrolyte imbalances such as hypokalemia or hypomagnesemia, hypocalcemia, or myocardial ischemia. In some cases, the etiology of torsades may be idiopathic. With regards to pharmacotherapy that can lead to torsades, the mnemonic A, B, C, D, E, F, no may be useful in remembering which drugs and drug classes may predispose a patient to the pathologic arrhythmia. Antiarrhythmics, specifically class 1A and class 3, as well as arsenic poisoning, fall under the A. Antibiotics is the B, specifically fluoroquinolones and macrolides. Antipsychotics, this one is a little bit of a cheat, but antipsychotics, where the C is the PSY in psychotics, specifically haloperidol and the drug chloroquine, also falls under the C. Antidepressants, specifically the TCAs and the diuretics, such as the thiazides, those are pharmacotherapies that may predispose somebody to torsades. Anti-emetics, specifically ondansetron or Zofran. Antifungals, specifically fluconazole. Navir, which is the suffix for protease inhibitors, which are often used in HIV treatment. This is a class of drugs that can sometimes predispose somebody to torsades. And then the O is for opioids, specifically methadone. It is essential to identify the underlying cause of torsades, as this will help in determining the appropriate treatment plan. Torsades is relatively uncommon, but more males do present with this clinically than females do. Torsades is a result of, again, a prolonged QT interval, which increases the risk of ventricular arrhythmias. The prolonged QT interval allows for the re-entry of an electrical wave leading to a specific pattern on the EKG. This pattern is characterized by a twisting of the QRS complex, which gives the arrhythmia its name. Torsades de Pointes literally means twisting of the points. The symptoms of torsades may include palpitations, syncope, and dizziness. The patient may also have a history of heart disease. They may use medications that prolong the QT interval, which we've discussed, and they may have electrolyte imbalances. During the physical exam, the healthcare provider may observe signs of syncope, low blood pressure, and tachycardia. The diagnosis of torsades is primarily made based on the EKG findings. The characteristic twisting of the QRS complex is the most significant diagnostic feature of torsades. In some cases, the healthcare provider may also order electrolyte levels, an echocardiogram, or home Holter monitoring to try and identify the underlying cause of any arrhythmia. Torsades is characterized by a prolonged QT interval, can't stress that enough, and a twisting, again, of the QRS complex, which appears to be twisted around a baseline in a corkscrew pattern. This ECG, or EKG, pattern is unique to torsades and helps differentiate it from other types of wide complex ventricular tachycardias. It is sometimes described as having a sinusoidal waveform or wave pattern, if that helps you to remember it. The treatment of torsades depends on the underlying cause. If the arrhythmia is due to a medication, then that medication should be discontinued if possible. Other treatments may include electrical cardioversion, administration of magnesium or potassium or calcium. Typically, however, in an acute setting, magnesium sulfate is the first-line therapy for a patient with torsades because it stabilizes the cardiac membrane potential with regards to the cardiomyocytes. So again, the first-line treatment for torsades is going to be magnesium sulfate so that you can stabilize the cardiomyocyte membrane potential. When diagnosing torsades, it is essential to differentiate it again from other types of ventricular tachycardias. These include ventricular fibrillation and supraventricular tachycardia. The management and treatment of these arrhythmias are significantly different, making differentiation critical for proper patient care. The prognosis of torsades depends on the underlying cause and the effectiveness of the treatment. If the arrhythmia is caused by a medication, discontinuing the medication may prevent further episodes. But if the arrhythmia is due to more severe underlying conditions such as heart disease, the prognosis may be more poor and more guarded. Torsades can lead to various complications, including ventricular tachycardia. You can actually move from torsades into ventricular tachycardia, which can lead to cardiac arrest and sudden cardiac death. VTAC is the greatest concern for a patient with torsades, as a patient can easily flip between torsades and VTAC. Additionally, if the underlying cause of torsades is not treated, the patient is at risk of recurrent episodes. In conclusion, torsades is a life-threatening ventricular tachycardia, wide complex, that can have various etiologies, including medications, electrolyte imbalances, and heart disease. A thorough understanding of this arrhythmia is essential for proper evaluation, proper treatment, and proper management. Again, please remember to like, comment, and subscribe so that we can continue to provide free medical education resources to students around the world.